Are there any other tests that you advocate for or you do yourself to kind of keep yourself in check as far as toxicity or just general health markers?
I number one will never go to a Western doctor for any of my tests because they're so basic and they're not advanced. So a Western doctor will test your thyroid and test your hormones and say everything is normal. Where, as you know, a functional doctor will really go in depth. Like when Will Cole takes my blood, it's like 30 vials. Whereas if you go to your Western doctor, it's like a vial or two of blood that they take. So I'm actually due to have like a comprehensive panel done, but I used to do the Dutch test, which I don't believe is accurate. I believe it's faulty. So I prefer to do like an advanced blood test for my hormones. I do the heavy metal test. But those are the two things I really try to keep an eye on the most. What other diagnostic tests do you like to do? Like, what are your...
I'm actually, I do the lab tests. I feel like a lot of them, even the more advanced ones, they give you a good understanding, but they're downstream a little bit. Like they're showing you the after effects of something. When you do some of the like more, I would say like HRV kind of testing, especially on autonomic response, like you can start to understand a little bit more of the initiation points that lead to those parameters. So if you have autonomic response that's off and you're too sympathetic, that's going to screw up your hormones and that's going to go downstream into different levels of things that may deplete you of your nutrients. So I'm like, I love the functional stuff, but I love to also correspond that with more bioenergetic, like oligo scan to double check what is within the tissue, not just the blood. What is the mineral count? What is heavy metal and nutrients? So it's kind of looking at both. And it gives you a little bit more of that picture of just what's in the blood, which a lot of times is, to me, downstream. So it's upstream as well. But I mean, I think in general, like understanding that everything is cause and effect, that if you have aluminum, you're not just going to have aluminum toxicity. That's probably going to impact a lot of other markers as well. So that's your kind of initiation point, but also understanding, is it stress? Is it something that those markers don't come up with? Can we prove that a little bit more so that we're getting cause and effect? The effect is all of the functional lab tests with the blood, and the cause is also being shown in a test and not just the determination of a practitioner.